Today we will discuss the model of the knee joint. So knee joint is a very complex variety of the joint because in whole of the human body the synovial joints they are mainly formed by the two bones. But here three bones they are participating: the lower end of femur, upper end of tibia, and the sesamoid bone, largest sesamoid bone of the body, that is the patella. So when we view the knee joint from the anterior side or the front side, what we see in the lower part of the femur, there are two condyles, the lateral and the medial condyle in the lower part, and in between the condyle there is a intercondylar smooth area that is called the patellar surface, which is large lateral and small medial in composition. And anterior surface of the tibia bears same condyles as the lateral and medial condyle, with the tibial tuberosity in front of the upper part of the shaft of the tibia. If we view the knee joint posteriorly, the posterior surface of the lower end of the femur represent the two lateral and medial lips of the linea aspera, or the posterior border of the femur. When we continue downward the linea aspera, the posterior border of the femur, medially it is continued as the medial supracondylar line, and laterally it bears the lateral supracondylar line. And in between the two condyles there is a intercondylar rough area of the lower end of the femur. If we see the posterior surface of the upper end of the tibia, we see here that the two condyles, the lateral and the medial condyles, are reciprocally, and the superior surface of the tibia, and which has got the large medial surface and the small lateral surface of the superior surface of the tibial shaft. Then posterior surface of the shaft of the tibia, it bears the soleal line, which is the oblique line for the origin of the soleus muscle, and laterally the shaft, and laterally is the fibula, the head, neck and the shaft of the fibula. Fibula doesn't take part in the knee joint formation because it is a non-weight bearing joint. So when we stand, the transmission of the weight goes from the femur to the tibia and then to the foot, and not by the fibula. So fibula is a non-weight bearing bone. So now when the knee joint is formed by the lower end of the femur and the upper end of the tibia, the first thing, the joint formation of